Hello, I'm Dr. Judith Boice, and welcome. I'm really delighted that you're interested in coming to work together at Siskiyou Vital Medicine. I'm sharing this information with you so that you can be prepared for that first visit, so you have more understanding about who I am and how I work with patients. I'll be sharing a bit about myself. I'll also be guiding you through a series of questions for you to think about to be prepared for our first visit together. I'll also share information with you about how you can take next steps to move forward to actually begin that process of working together. So thank you so much for your time in watching this video. So the first thing I want to share with you is a little bit of information about who I am. I'm going to give you my academic background, my professional experience, and then I'm going to be giving you my real qualifications to consider working together. I'm a graduate of the National University of Natural Medicine. It was the National College of Naturopathic Medicine when I went through school. I also have a 3-year master's in acupuncture and oriental medicine from the Oregon College of Oriental Medicine. I've lived and traveled with Indigenous people around the world, and I actually think that that is one of my most important qualifications because those experiences taught me that health is about the way we live our life. It's not about the pills that we take. It's not just about the food that we eat. It's the whole of our lives that make up our health. I've been in practice now for 25 years. I've written 10 books, 4 of which have won 5 awards. I've worked at this point with thousands of people with chronic conditions and chronic pain. I'll say a little bit more about that as we go through. 3.5 years of my 25 years in practice. I worked at Cancer Treatment Centers of America at the Southwestern Regional Medical Center in Tulsa, Oklahoma. So I have experience working with late-stage cancer patients. I'm a fellow of the American Board of Naturopathic Oncology, which is an additional board certification in naturopathic oncology. I'm a professor at 3 different universities, actually now as of yesterday, 4 different universities, and I'm also a senior vitalist of the Naturopathic Medicine Institute. So that's my highly trained monkey qualifications. Now I want to give you what I feel like are my true qualifications. I've had chronic health issues since birth, which I'll say a little bit more about in a moment. I won't give you all the gory details of my life history. I've had to work really hard to restore my health. And the truth is, I didn't have that much health to restore to begin with. So I've had to work hard to build my health. So I've pretty much done anything I've ever asked a patient to do, plus more. I strongly identify with the archetype of the wounded healer. Some of you may be familiar with the Inuit word shaman. Shaman is actually a very specific type of medicine person. It's started to be used generically, but it's actually a very specific type of medicine person. The shaman is someone who, through illness or injury, they've moved right to the edge of death, and sometimes they've actually crossed over and clinically died, and then they've had to learn the territory back to health. So that person, the shaman, deeply understands the landscape of both developing really serious disease or injury and then also the process of restoring health. They have to know that territory to be able to guide others. And so in the Inuit tradition, the shaman rides in the spirit canoe or the spirit boat and crosses over to the other side and brings important healing information, healing skills back with them. So I really strongly identify with this archetype of the wounded healer because of my own experiences and having to restore my health. So just a little bit, I promise I won't give you a whole long story. A little bit of my background is that I was born without a hip socket on one side, and bless him, I'm so grateful to Dr. Barron, the OB, still makes me teary, the OBGYN who delivered me, because he caught right at birth that that I was missing a hip socket. And I was immediately put into this pillow. It's called a FRICA pillow that splays your legs out at a 45 or a 90-degree angle. And that positions the head of the femur, the top of the thigh bone, so that over time it gradually grinds a hip socket. If Dr. Barron had not caught that I was missing a hip socket, what normally happens for most children is that the condition's not discovered till they're about a year old, and they get up and they try to walk, and the head of the femur just slides up and down on the pelvis. There's no hip socket to hold the thigh bone in place. So bless him, Dr. Barron caught that. I was put in this FRICA pillow, and over time it gradually ground a hip socket. It's not perfect. I tend to have a lot of sacroiliac dysfunction stuff, but I can walk, I can hike. I used to be a runner, so I'm so grateful for that. It also meant, though, that because my legs were splayed out like this, I didn't walk very well. I couldn't move very well. I was a fat kid. I had a lot of health issues. My mom said she got nervous every 6 weeks because she knew I was going to get sick and I would get ear infections. I had pneumonia, bronchitis, phlebitis. I had all kinds of different health issues growing up. So by the time I was 10 years old, I was motivated. I was sick and tired of being sick and tired. And I started reading everything I could get my hands on about health in the library and began to make changes in my own life. Started running. I changed my diet. I was reading all the one-size-fits-all books that were available at that time about what you should eat. When I was 13, I had a 3-month, 4-month bout of bronchitis. My mom kept taking me back to the doctor, and the doctor kept giving me more rounds of antibiotics. And finally, my mom cornered the doctor and said, "What? I don't get it. Why is she sick? She's running. She's eating well. She's sleeping. How come she's sick?" So I think in self-defense, the doctor referred me to an allergist, an EENT doctor, eye, ears, nose, throat doctor, who tested me for food allergies because he didn't know what else to do either. I came back with about 10 different mild food allergies, and he said, "You can remove them if you want to. It's up to you." I was motivated, so I removed them, and within 2 weeks, that long bout of bronchitis cleared. So that was my first experience of having tailored medicine, individualized medicine, and I saw the power of it and how much difference that made in my life. So that's a little bit of background about why I'm motivated. I'm really interested in shortening the trajectory for you. I continued gradually, slowly over time to learn more and more and more. It's definitely been a 45-year journey, 45 plus year journey for me. I'm interested in shortening your time and your journey to the point that you're able to have the level of health that you desire. So it's a little bit of background about me. I'm going to come back to this in just a moment. So I'm assuming that you're here because you are working with some kind of health condition right now, whether that's cancer or chronic fatigue, fibromyalgia, irritable bowel, Crohn's disease, whatever the chronic condition is that you're working with, an autoimmune condition. I work with a lot of people with autoimmune diseases. You may be just beginning this journey of working with your health. You may be a battle-hardened warrior at this point, somewhere in the midst of the process, or you may be someone who's come through a major health crisis like cancer, and you're now interested in being a cancer thriver. I don't like the word survivor. I like the word thriver. So wherever you are on the journey, one of the things that I'm aware of is that a major illness brings the possibility of death right in front of our face, and many people get really clear on what's important for them in their life. I would never wish cancer or any kind of chronic illness on anyone. And one of the gifts from my perspective is that you get really clear on what you want and what's important. So I want to offer you some questions to ask yourself in preparing to work together. And the first one is, if you could distill the essence of what it is you want to work on in one sentence, what would that be? Not a paragraph sentence, not a Winnie the Pooh sentence, as my mom would say, but just one short sentence. What is it that you want to focus on? What is it that you want to work on? So if you need a moment to think about that and write it down, go grab pen and paper, come back, sit down, pause the video, and write down, what is it that I want to focus on? Give me one sentence. Okay, after you finish that, the second question is, are you interested in being healthy? And most people look at me and think, well, of course I want to be healthy. Why else would I be here if I wasn't interested in being healthy? But for me, that's a real question. Not everyone is interested in being healthy, and nobody's required to be healthy. That's hard-won wisdom for me. No one is required to be healthy. So it's a real question. Are you interested in being healthy? So I'd encourage you to write a bit about that. And the third question is, what does health look like for you? What I mean by that is, what would you be doing if you had all the time, all the money, all the energy, all the resources, if you had everything that you needed and wanted, what would you be focused on? What would you be doing? A lot of people often look at me kind of like doe in headlights, like, well, what do you mean by that? So I'm going to give you a couple examples just to start your own creative process, your own thinking. So I had one patient, actually late stage cancer patient, who wanted to travel to Italy and see the works of Michelangelo in their native environment in person. I had another patient who wanted to run 3 Ironman competitions a year. That was his vision of health. Another patient, she wanted to have enough energy to get home, to come home at the end of the day, to paint in her studio and go bike riding with her grandchildren. That was her picture of health. A lot of people, when I ask, what does health look like for you? They start telling me all the things they think they need to do to be healthy. That's not what I'm asking. I'm asking, what would you be doing? What would you be focused on if you had all of the energy, all of the health and vitality that you desire? What would you be spending it on? What would you be focused on? What would you be doing? How would you be with that vitality, with that energy? That's your picture of health, not what you think you need to do to get there. It's what you would be doing with that vitality. I want to give you a little background about, and again, pause the recording, because for many people, this is a very different way of thinking about their health. And it may take you a little bit of pondering to come up with an answer to that. State it in the positive. And so instead of saying something like, I want my pain to go away, you'd say, I want to be pain-free. Also think about by when you want to have these things. And some of them may be yesterday, but also think about when you really want it, not what you think is possible, but when you really want something to happen. Also, if you have the level of health that you desire, it may be that your timeline is that you still want to be doing certain things in 10 years, 15 years, 30 years. You want to continue being able to do what you're doing now. That may be your timeline. So a little bit of background about the difference between creating and problem solving. If I have a problem, let's say this pencil in my hand is a problem, and I get rid of the problem, what's left? What's left in my hand? Nothing, right? So problem solving helps us get rid of something. It doesn't bring something into being. So problem solving eliminates things. It doesn't bring into being anything. So most of us approach health as problem solving. I have this symptom. I want this symptom to go away. But if I approach my health as things I want to go away, what am I left with? Nothing. I'm left with the absence of symptoms. I'm not left with the presence of health. Think about a painter. When a painter is working on a canvas, they don't look at the canvas and say, well, how do I get rid of the problem of that canvas? They're busy focused on what they want to create on the canvas. That's a completely different process than getting rid of something. You may use problem solving in the service of creating. So for example, that painter may be trying to figure out, well, how do I get this certain effect on the canvas? Or how do I mix this certain color of paint? Problem solving in the service of creating will get you somewhere, but problem solving alone will not get you anywhere. I have a dear friend, her name was Phyllis Rode, and she passed when she was 100. And she used to say, you know, you can't just go to the bus station and buy a ticket. You got to tell them where you want to go. So I'm offering you an opportunity to write your ticket. You have to have that ticket before you get on the bus. So the first step is know where it is you want to go. The second step is, and again, pause the recording if you want some time to think about that. And I would really encourage you to deeply ponder it, because it's a very different thought process than most of us have when we're working with our health. The second step in this work with creating health is to know where you are now in relationship to where you want to go. Just like the analogy of a bus station, you got to know where you are before you get on the bus to make good decisions. So for example, if I'm here in Southern Oregon, but I tell myself that I'm in Chicago and I'm trying to get to Miami, Florida, I'm probably not going to make it. I'm probably not going to get there. So it's a really important piece to know where you currently are. Most visioning exercises pay absolutely no attention to current reality. But if you don't pay attention to current reality, there's no rubber on the road. And that's really critical, because the next piece is then to notice the difference between where you are and where you want to be. So this is my prop here, a rubber band. The difference between where you are and where you want to be creates a stretch, like a stretched rubber band. And that stretched rubber band is potential energy to move you towards where you want to go. A lot of people don't like the stretch, though, so they do things like diminish the vision. Well, maybe I'd be happy if I just ran 2 Ironman competitions a year. Or they misrepresent reality. They tell themselves that things are better than they really are, rose-colored glasses, or they tell themselves things are worse than they really are, catastrophizing. Oh my gosh, if ABC doesn't happen, then XYZ is going to happen. That's catastrophizing. So it's a learned skill. Tell yourself the truth about where you are. Tell yourself the truth about where you want to be. I'm going to say just one more word here about telling yourself the truth. It actually takes more energy to lie to yourself about what you want than to tell yourself the truth. So you may have a really advanced illness and not know for certain whether or not you can actually have what it is you want. I would encourage you, tell yourself the truth. Tell yourself what you really want to create. And you don't know. You don't know until you begin the journey what's possible or not possible. Plus, you don't have the added burden of lying to yourself. And the next step, there's an exercise that I take people through in their first visit, which I won't go through here. But these are really important questions to ask yourself. Distill the essence of what it is you want to focus on, one sentence. Second question, are you interested in being healthy? Third question, what does health look like for you? It's your picture of health, nobody else's picture of health. What does health look like for you? And the fourth step, what's current reality in relationship to what you want to create? So for example, if you want to run 3 Ironman competitions a year, what's current reality? It might be, I'm only running 1 Ironman competition a year. Current reality may be, I've never run an Ironman competition a year. So that current reality is also going to be dependent on where you are right now. The last thing I want to share with you is a little bit of information about how I work, so that you're aware of, familiar with how I work with patients. Oh, there we go. All righty. The name of my business is 7 Winds Institute, and the name 7 Winds comes from Tibetan culture. In Tibet, they talk about the directions as winds. So there's the 7 directions are east, south, west, north, just like we have in the West, plus above, below, and within. And most indigenous people have this understanding of there being 7 directions, not just 4, but 7 directions, including above, below, and within. When I work with someone, I'm thinking about all 7 directions as I'm working with them. And I have different associations with each direction, so I'll go through this briefly. I think of the east being associated with our vision, and we just did a bit of work with that. Where is it that you want to go with your health? The south is movement, exercise. The west is mental, emotional health. The north, and by the way, I'm pointing in the directions from where I'm sitting right now. The north is diet and musculoskeletal health. Above is being in right relationship with self, with community, with family, with creator. The below direction is relationship with the earth, and that includes environmental medicine. And finally, the 7th direction is where all of those other directions meet: our spirit, our soul, our deepest self is that 7th direction. So notice I haven't said a word yet about supplements. I haven't said a word yet about pills or herbs or homeopathics. To me, these are the foundations that our health rests upon. I'm constantly thinking about them as I'm working with people. These are the pillars of health. Some people have incredible strength in one area with one pillar, and they don't have much development in another. So the recommendations are individualized for each person for what's appropriate to them, and all of the suggestions are lined up with your true north, which is your vision of health. So your true north is the work that you just did on your picture of health. And then my work with you is to figure out, how do we line up everything that you're doing to move you towards your vision of health? I also have an understanding when people are dealing with chronic illnesses of recalibrating the body. And I'm going to use the piano analogy two different ways. First is, if you think about, this is a quote from Albert Einstein, we can't solve problems by using the same kind of thinking we used when we created them. Cancer in particular, cancer cells are smart. They keep working around all the different ways that our body tries to find to take them out, basically. The cancer cells are smart. They're our own cells that have mutated. They're intelligent. They're great at surviving. But so it's important to fight cancer on its own terms, or whatever the condition is that you're working with. It's important to address cancer on its own terms, but you will never completely win in working with cancer on its own territory, on its own turf. The analogy that I use is, think about everything that's in the room, like where I am in this room, everything is wired for 120 volts. But what if I ran 500 volts, 700 volts, 1,000 volts through that wiring? What would happen? It would blow up, right? So I think about cancer and other kinds of disease as being, let's say that for argument's sake, that analogy's sake, they're 120 volts. But what if I do something within my body, within my being, to recalibrate myself to 500 volts, 700 volts, 1,000 volts? The cancer can't live there anymore, right? So when I'm working with people with a chronic condition, with cancer or other chronic conditions, I'm thinking about, how can you recalibrate your body, up-level your body, so that you are working at a different vibratory rate. We can work on that same turf as the cancer and work with fighting the cancer on its own territory, and that is important to do. And it's important to do the recalibration work so that your body is no longer a hospitable place for the cancer or whatever the chronic illness is to continue. I also use the piano as an analogy to think about different types of medicine. And I want to share this with you because this is my particular bias in working with cancer and other late stage conditions. I think about medicine being like a piano keyboard. I have a musical background, so I often use musical analogies. If you think about the piano keyboard, the bass notes, I think of being like drugs and surgery. Middle C are food and herbs, and then the upper end of the keyboard are the more energetic, subtle therapies, like working with homeopathy, flower essences, acupuncture, qigong, prayer, meditation. Those are the upper end of the keyboard. Everybody has a home base on that keyboard, a resonant note. Like in physics, they talk about the theory of resonance. So if I went and I hit a particular note on the piano keyboard, there would be certain things in the room that would start to vibrate because they are resonant with that particular frequency, that particular sound. Each of us has a resonant place on this keyboard with those different types of medicine. And what I've learned over time is that when someone has cancer or a late stage chronic illness, my bias is bring out the whole keyboard. There's no barbed wire fences between any parts of the piano keyboard. The whole keyboard is open. You can use wherever your particular note is, your resonant note, to be able to tolerate the side effects of the other treatments. I tend to work with people whose home base is from middle C to the top of the keyboard. And there's sometimes when people really need to dip into the bass notes, drugs or surgery, other kinds of more invasive therapies, to support them in that process of completely recovering. So my bias is like Rachmaninoff. Rachmaninoff, when he wrote a piano concerto, his aim was to use every single note, every single key on the keyboard by the end of the piano concerto, and he would do that. So I would encourage you, if you're working with a chronic or a late stage condition, be open to the entire keyboard. And I'm happy, and by the way, I am happy to work with people no matter where they choose to work, whether they want to work with the whole keyboard, whether they only want to work with the upper half of the keyboard, whether they want to combine. And by the way, that's my training. It's not an either or choice. You don't have to choose just the bass notes or the upper end of the keyboard. You can choose to use the entire piano keyboard. It's not an either or choice. And I'm happy to work with you however you decide you want to work with that keyboard, with those different systems of medicine. Finally, I want to go over some of the financial investment for yourself and working together so that you understand how I work. I tend to work with people with more complex chronic conditions. So I have advanced levels of membership. So if these are my fees for service, if someone walks off the street and just wants one visit at a time. So I sat down and figured out at one point, if I do what I normally would do in a visit, my average visit would cost about $300 to $500. Just quickly, Bowen work is very gentle, non-force manipulation work. Cold laser is also known as low-level energy laser, which is used for neuropathy, joint and muscle pain, slow healing tissue. Clinical hypnosis is part of my background. Microacupuncture is a specific type of acupuncture for eye restoration. I also work with homeopathy, acute and constitutional homeopathy, Chinese herbs, Western herbs, flower essences, diet. I work deeply with diet, exercise, Qigong. I'm trained to teach 3 different forms of Qigong, and I'm a lineage holder for 1 form of Qigong. I do a lot of different things. So if I charge for everything I did in a visit, it would be about a $300 to $500 visit. If people come in for basic membership, and that's the basic level of direct primary care is meant for somebody who comes in, they occasionally have a cold, they have a sunburn, they need stitches. That's the level of a basic direct primary care membership. Again, I tend to work with people with more complex conditions. So I created a member plus and a member platinum level. The member plus level, let me back up and say, in the basic membership level, you pay $100 a month, but if you wanted any additional of my services, you would have to pay for the additional services. $50 for a return acupuncture visit, $50 for Bowen work, $40 for cold laser. And these are discounted rates, but you still have to pay for those things individually. And then if someone knows that they're going to be requiring more support and they know they're going to come in for 2 visits a month, then there's a member plus level. They pay $200 to $300 per month. There's no set way of deciding. I trust that you will be able to figure out where you fall between that $200 and $300 according to your income, your resources, whatever savings you have available. You choose your level between $200 and $300, and then all of these different services are included. You don't pay any extra for those services. If someone knows they're going to need weekly support, 3 to 4 times a week for a period of time, then the member platinum level is $300 to $500. Again, this is an extraordinary savings. Remember that normally just one visit would cost that much. All of these different services then are included. And for anyone at any level, there's a 30% discount on supplements that you purchase through the clinic. There are discounts on classes. So for example, when I offer Qigong classes, there are discounts. You're welcome to come to all of the free lectures at the clinic, and there are also discounts on IV and intravenous services if you're doing that as part of your treatment. So your next step, if you are interested in working together, is to call and book an appointment. The first consultation is an hour. For cancer patients, it's 90 minutes. There's no extra charge for it, but for cancer patients, I spend 90 minutes, but just because there's so much information to catch up on when someone is working with cancer. So call the office, book your first consultation. That first consultation is $250. If you decide, though, at that visit that you want to move to one of these levels, the member plus or the platinum level, then that you begin immediately in that new membership level, and that first office visit is included. So for example, if you come in, you have the first visit and you think, I'm not sure if this is what I want to do right now, or this just isn't a good fit for me, then you pay the $250 the $250 for the visit, and we're complete at that point. If you go through the first visit and realize, oh, I do want to work with a membership, either a membership plus or a membership platinum, then you would go to the front desk and say, I'm going to be signing up for the member platinum level. And then you would start paying the $300 to $500 for the month, and that first visit would be included in that monthly fee. I forgot to mention this detail. When you sign up as a member, you make an initial commitment for 1 year. You may not be at the same level for the full year, but you've made the commitment for the year. So for example, someone who has chronic pain, they might start at the member platinum level, and then after 3 or 4 months, their pain may have improved to the point where they're just coming twice a month, then they move to the member plus level, and then at some point they may be more on a maintenance level, and then they move to the basic membership level. So you're making a commitment for a year. You're not necessarily committing to a particular level for a year. And that we sit down together, we collaboratively figure out if you're going to be shifting from a level or from one level to another. So please do, I would be delighted to work with you if this information sounds like a fit for you, a match for the level of health that you want to create. I would be delighted to work with you and walk with you on that journey towards the level of health that you desire. So the next step would be to call Siskiyou Vital Medicine at 541-210-5687. Book that first appointment, and then we can go from there to figure out what level of membership would best support you. Thank you so much for being with you. Remember to bring with you your responses to these questions so that we can bring that into the visit. Many, many blessings to you.